So good evening. Today we'll be discussing the NIMHANS 2020. The aim of this learning is basically to establish, because we all know that the NIMHANS exam is important, as whatever is the MCQ asked in NIMHANS will be later taken over and the asked in the various exams. So that's a role, and we at this NIMHANS series would try to cover up not the MCQs of NIMHANS but the detailed discussion of the NIMHANS MCQs. My referral code is DR Sandeep-YT to get 10% discount, and let's crack the NEET PG and the INI examination. So this is what we have to offer you now at the platform of Unacademy. There is an iconic subscription. You can get the best of the Unacademy and best of the prep ladder. We have been running a grand test every time, every month, twice in a month. So you can join it free and enjoy the learning and test your knowledge every time you wish to learn. Good evening, Dr. Usha. And we then have this, the iconic subscription has the combination of the best of Unacademy learning and the best of the prep ladder. So you can enjoy the live learning and recorded session completely at a nominal cost of about 4,200 per month for 12 months. And if you go for 3 years subscription for 82,000 rupees, it will be around 2,300. So this is my referral code to join up the this platform of Unacademy. So let's do the MCQ one by one of NIMHANS, because as per experience the MCQ of NIMHANS, JIPMER and the PGI, they later on reflected in the AIMS exam, and there they have been picked up. So the first MCQ we have been asked in NIMHANS is again a lollipop. In fact, most of the MCQs appear to be a lollipop if you know the basic. And Dr. Usha said it's a cluster A. Cluster A we all know. Anybody else? We know in psychiatry understanding. So Dr. Anushka also say cluster A. So personality disorder has been classified as cluster A, B and C. Cluster A are the odd and eccentric. B is the attention seeking. C is anxious. In this we have paranoid PD, schizoid PD and schizotypal personality disorder. Here we have the narcissistic PD, antisocial PD, histrionic PD, and borderline PD. Anxious, we have the anxious avoidant. We have the dependent, and we have the anacastic PD. So that is the three clusters defined in psychiatry: cluster A, cluster B, and cluster C. Are you able to hear me, or my mobile connection is poor, or it is appear to be dragged up? So it's a delay one going on, but no problem. Let's go to the next question. It will clarify the doubt. The next question is, genetically, bipolar disorder is associated with the all of the following chromosome except. It is hanging up. Genetically, bipolar disorder is basically we know that latterly so all except, sounding slow, okay, except the, we know the latest gene they say is the 18q, 21q and 22q. That is the genes in the bipolar disorder. No, it is the 5 is not there. 18, 21q, 22q, we know both of them are also in the schizophrenia. So in schizophrenia, the 6q, 9q is also there. So 5R is not there. But difficult level question. So in schizophrenia we have 21q, 22q, 6q and the 9q. Okay. Now we know the other illness where the genes has been important is the Alzheimer's disease. We know in this we have the APOE4 gene on chromosome number 19. We have the pre-selenin 1 gene on chromosome number 14. Pre-selenin 2 gene on chromosome number 1. Ubiquitin gene on chromosome number 9. APP gene on chromosome number 21. So there is some trazine on chromosome number 6 also has been reported. So that is what is the all the list. So they used to trouble us in the Alzheimer's disease through genes. Now they are asking genes about the the other things also, the bipolar disorder, schizophrenia. So in psychiatry, the genes has been trying to find out the genetic lesion, and they're trying to improve the illness by the gene therapy. So there is a role of this knowing all this. So there is a lag, I think, in so let's move on. Okay. The following scientist has their contribution with respect to the schizophrenia, except. So they want us to tell us all the names of the schizophrenia scientist. We know the Bellary is a man who coined the term schizophrenia and given the 4 A's of schizophrenia, namely autism, ambivalence, affective blunting, and the associational loosening. Schneider is the man who given the first rank symptoms of schizophrenia. He is the man who given the first rank symptoms of schizophrenia. Kraepelin has classified the psychosis into and given the name called dementia precox. So that is the William Cade is not there here in schizophrenia. ठीक है डॉक्टर साहब. Now we have the also we mean the schizophrenia, the professor called T.J. Crow is also one there. He classified schizophrenia into type 1 and type 2 schizophrenia. Type 1 and type 2 schizophrenia. C or D? Oh, डॉक्टर साहब देखिए, Kraepelin has given the man, Kraepelin is a man, it's a C, it's a D basically, except the William Cade, who did not talk about anything. Kraepelin is a man who, first of all, classified psychosis into the M.B.B. and dementia precox. He says there is a psychosis, actually episodic psychosis, manic depressive psychosis, and it's a dementia, chronic illness with the dementia come early. It is very slow today, I don't know what happened. Dr. Usha is trying to help us by telling so many things about it. So yes, it is a disorder of the positive symptom, negative symptom. We say anything extra in me will be called as the positive symptom. Delusion, hallucination, violence is a positive symptom. And anything which all of us have, they don't have, is a negative symptom. So, amotivation, asociality, alogia, they will be called as the negative symptom. ठीक है डॉक्टर साहब. Next we come on to the, according to the National Mental Health Survey, lifetime prevalence of depression in India is lifetime prevalence of depression in India is the technology lag giving a trouble. So answer is the 15%. So lifetime prevalence ओके आपको सही दिख रहा है. ठीक है, मेरा शायद मोबाइल में प्रॉब्लम होगा. वॉइस इज नॉट लैगिंग, दैट्स बी. वेरी गुड. सो लाइफ टाइम प्रेवलेंस ऑफ डिप्रेशन is the 15% across the USA and also in the India. Lifetime prevalence is that the lifetime what is the risk that I may have depression in my lifetime. ठीक है डॉक्टर साहब? Yes, you're right. The answer is B. Now the burning sensation in the brain is known as the synesthetic hallucination, kinesthetic or reflex hallucination, or extra campine or extracorporeal hallucination. So we know the reflex is another name for the synesthesia. काइनेस्थेसिया मतलब मूवमेंट hallucination. Synesthetic is a hallucination of from the visceral organs. So burning sensation in the brain is called as the, बताइए डॉक्टर उषा, आप ही हैं हमारे साथ. It has been a drag, lag and confusion happening. It is a new question, first time being asked, and it's a hallucination of from the visceral organs, itching in the brain, itching in the intestine. That will be labeled as a synesthetic hallucination. 1, very good. It's a synesthetic hallucination. So anything which is coming from the visceral organs, that will be called as the kinesthesia. Now what is the predictor of bipolar disorder? Stable temperament, poverty, high density third generation pedigree, onset of bipolar in the middle age. We know that it's a cyclothymic temperament, onset in the early young age, predict the bipolarity. But in this question the answer would be C, high density 3 generation pedigree showing a bipolar disorder. So that's actually indicator that now this time they have been asking what is so it's a middle age, onset in the middle age. Poverty is no way, cyclothymic temperament, so answer is the C. ठीक है डॉक्टर साहब. Acute dystonia. What is synesthesia? Synesthesia is another name for the reflex hallucination. So Dr. Usha has been asking what is synesthesia. It's another name for the reflex hallucination. What actually it is? Stimulus in the one modality causes hallucination in the other modality. So we had an MCQ that synesthesia has been commonly found in the cannabis and LSD. Among the two, more in the LSD. It's a cannabis and the LSD. So answer you say it's C, or for which one I don't know. So my picture is lagging so much. So very good answer is C. Acute dystonia is caused by the dopamine blockade. We know dystonia happen, it is the earliest side effect. Though the most common side effect is the akathisia, it is the earliest side effect happen because of the dopamine blockade. Treatment is the injection phenergan, what do you call? Promethazine. Promethazine, it releases the acute blockade of dopamine. Yes, like visual calling auditory. So cannabis में आपको याद है डॉक्टर साहब, the moment I never hear any voices. इसका मतलब क्या हुआ? Dr. Usha is asking. Synesthesia is, I'm sorry, we are taking a different tool. So the promethazine by indirect pathway release the dopamine blockade and lead to the improvement in the acute dystonia. Dopamine blockade is the answer. Welcome, Dr. Vasvi. The cholinergic disbalance lead to the Parkinsonian symptom. The lack of dopamine, again the excess of cholinergic lead to the Parkinsonian-like symptom. But Dr. Usha is asking about the visual causing auditory causing visual. So आपको याद है, हमने पढ़ा है forensic medicine में that after taking bhang ganja, colors are being heard and the music is being seen. रंगों का सुनाई देना, म्यूजिक का दिखाई देना, it is nothing but the synesthesia. Colors are heard and music is being seen, it is nothing but the synesthesia. ठीक है डॉक्टर साहब? So answer is B. Very good. Now the severe chronic side effect of the tardive classical antipsychotic is akathisia. We all know is the most common side effect. स्टीवन जॉनसन हमारे यहाँ होता नहीं, मतलब एंटीसाइकोटिक से नहीं होता. सो वी नो टार्डिव क्रोनिक. टार्डिव का मतलब होता है, टार्डिव मीनिंग, आंसर इज टार्डिव मीनिंग स्लो. So we know it happens in ears. It's a chorioathetoid movement of buccolingual masticatory muscles. Simple English, you can say movement around the mouth and of limbs. Late side effect. So earliest is dystonia. We know the most common side effect is akathisia. The earliest side effect is the dystonia. And the late side effect is the tardive dyskinesia. The other point which has been asked in tardive dyskinesia is, which is a next level MCQ, how does it happen? Now if I tell you this is the D2 receptor, for years together my D2 have been blocked up. So theory says that the chronic blockade of D2 receptor leads to D2 upregulation in some patient, leading to tardive dyskinesia. ठीक है डॉक्टर साहब. थोड़ा वॉइस लैग है डॉक्टर साहब, सॉरी है. तो बट वी कांट डू, वी ट्राई टू डू बेस्ट. आई डोंट नो व्हाई इट इज हैपनिंग. Yes, very good, Dr. Usha. So now the MCQ has been asked that, so this is because of this method. Now if you plan to decrease the dose, if you decrease the dose, what will happen? This receptor is also free. So there is a initial worsening of movement on decreasing the dose. Okay. Treatment is stop all drugs, give clozapine, give tetrabenazine. ठीक है डॉक्टर साहब. So that is also an MCQ. Patient of schizophrenia on haloperidol now developed tardive dyskinesia. Doctor planned to reduce the medicine. What should he tell the patient? He should tell the patient that movement will worsen initially on decreasing the dose. Oh my God. एम्स BSc नर्सिंग और BAMS में डॉक्टर साहब ऐसा मत करिए. BAMS क्या बेस्ट है? डॉक्टर साहब बड़ा मुश्किल सवाल है ये. देखो, नर्सिंग विल बी ऑलवेज नर्सिंग. Depend upon, if you go to abroad, then the nurse is better than, enjoying life, but the payment is there. बहुत मुश्किल सवाल है डॉक्टर साहब. BMS will be doctor, at least applying, the government job, and doctor will be doctor, but there is a very bad condition of the government Ayurvedic doctors has been done. क्या बेस्ट है? दैट्स आई विल नॉट बी द राइट पर्सन. देखो, एम्स का BSc नर्सिंग तो अलग ही बात हो जाता है. यू मे गो टू टीचिंग, यू मे गो टू एकेडमिक्स, देन BSc नर्सिंग, MSc नर्सिंग, एंड देन इट विल बी अ डिफरेंट लोड. पर कॉग्निटिवली यू हैव टू बी मैच्योर इनफ टू ओवरकम द नर्सिंग बैरियर. BMS is also picking up in the country, but till today I tell you it's very not good. So बड़ा मुश्किल सवाल है डॉक्टर साहब ये. It's depend upon the mindset. If somebody is of clear mindset that he has to join the BSc nursing and then go to teaching and upgrade up himself, that's great. Otherwise BMS में भी ज़्यादा कुछ फ़ायदा नहीं होता है. They are treated like a second grade citizen in the medical field. मुश्किल है उसमें भी बहुत. But it is coming up. BMS role is also picking up in the country and abroad. पर थोड़ा समय लगेगा. You can't predict because मुश्किल है. The quality of life will be different. Now let's do the last question, DMDD. The latest of the DSM-5. That's a बड़ा मुश्किल सवाल है. I am sorry, I will not be able to answer this question. देखिए, it will lead to many controversy. Let us not generate any controversy. Okay. You can discuss with me on my number. You can take my number from the internet. Is available everywhere. So we can discuss personally, but not let this platform to discuss that. Let's do the MCQ, which is not a feature of DMDD. DMDD is a disruptive mood dysregulation disorder. It's a latest category added in the DSM-5. So थोड़ा हट जाते हैं हम. Lamotrigine, valproate. So it is basically placed with the depressive disorder. Irritable child. So answer is the 3 times per week the aggression is disproportionate. Three times per week for 1 year. Happen in the children between 6 to 12 years of age. D, yes, very good. So it is placed along with the depressive disorder. And the treatment is SSRI. So not the mood stabilizer. So you can, my number is this. You can just contact me. We can discuss this personally. Okay. Three times per week for 1 year. And that's a D. ठीक है डॉक्टर साहब. So one more last question. Which of the following drug is absolutely contraindicated with the use of SSRI to avoid the serotonin syndrome? We know the monoamine oxidase inhibitor. The phenyl gene will be the contraindicated because this lead to the serotonin syndrome. Serotonin syndrome, basically it's a, पढ़ लेते हैं डॉक्टर साहब, इसको भी ख़त्म करते हैं. So it is a triad of the cognitive, autonomic and neuromuscular symptoms. Anxiety, delirium, hypomania, mania. In autonomic we have the diaphoresis, increased sweating, increased pulse, increased BP, increased respiratory rate, myoclonic jerks. Sorry, Dr. Sir. Seizures. Treatment of this is the ciprofloxacin. Okay. And that was DMDD, disruptive mood dysregulation disorder. The angry child later on going to be depressed, that's a DMDD. 3 episodes of aggression per week for 1 year. Starting from 6 years to 12 years. Placed with the depressive disorder. So hope you enjoyed the discussion of 10 questions. I'm sorry for the poor coordination between me and the mobile and the some system, but hope you are there, and thank you Dr. Usha, Dr. Vasvi to actively participate and keep our morale up. So thank you so much. Good night. So we have a lot of special classes remaining. So any topic Dr. Usha, Dr. Vasvi you want to learn, you can share it here. We can take up that in the free special classes. You can join us on the Unacademy Learning app. We are running a free classes, special classes of topic of the student's choice. And actually the ritual was of every Thursday, every Saturday, Sunday, 11 to 12 we have a psychiatry ritual class. We have a tomorrow also YouTube at 10 o'clock again. Tuesday 10:30 is the ritual of YouTube. But this week there is a lot of plus courses going on. So next week we have 5 days to do got it class. Okay. So any topic you would like to learn, you can share it here before we close it. So thank you so much. गुड नाइट. कोई टॉपिक नहीं डॉक्टर साहब शेयर करना चाहेंगे, आप बताना चाहेंगे? टू लर्न एट द प्लेटफॉर्म ऑफ अनअकैडमी in a free class without you can